Good afternoon, honourable ministers, distinguished guests, ladies and gentlemen. Welcome to the launch of WHO's Health Emergency Appeal 2024. We'd like to begin today's event with a short video before handing over to WHO's Director General, Dr. Tedros Ghebreyesus. Thank you.
Behind every conflict, climate, food, and humanitarian crisis, there is a health crisis. In 2023, emergencies disrupted the lives of millions of people around the world with an enormous impact on health. Thousands of health professionals responded, many on the front lines. And WHO was there to support them. When they ran mobile clinics to treat trauma wounds, when they went door to door to deliver life-saving vaccines, when they coordinated with partners, and when they delivered medical supplies to reach hospitals in need. But why do they do this?
Because the children need us.
For them and for their families.
Alleviate their suffering.
To have a future.
Have access to quality health services they need.
For the most vulnerable.
Because it's the right thing to do.
Because health is everything.
Parce que l'urgence humanitaire met en priorité.
Because I want to help.
Make my life meaningful.
We are people with solutions. We are people who are doing what it takes. We are committed, intrepid, and determined. We are the World Health Organization. In 2024, WHO will continue to work to help a mother deliver her baby safely in a war zone, to help vaccinate a child, provide mental health services to a father scarred by conflict, and to give a grandmother in a shelter her life-saving diabetes treatment. But we can't do this alone. In 2024, WHO needs $1.5 billion to respond to the health needs of the most vulnerable children, women, and men. For this, we need your support to do everything we can and more.
I now have the pleasure in inviting Dr. Tedros Ghebreyesus, the WHO Director General, to provide opening remarks.
Thank you so much. Excellencies, dear colleagues and friends, good afternoon, and thank you all for joining us today. Most of us have just returned from holidays, a time spent with family and friends, reflecting on the year that has passed and looking forward with hope to the new year. Happy New Year. While I take this opportunity to wish you all a Happy New Year, we must remember that for hundreds of millions of people, 2024 is not a Happy New Year. This year, an estimated 166 million people will need life-saving humanitarian health assistance. For them, it's traumatic start to a new year, and it comes on the back of 2023, which was itself a year of immense and mostly avoidable suffering. We have all been appalled and saddened by the impact of conflicts in Sudan, Ukraine, Ethiopia, Haiti, Myanmar, and of course, Gaza. Shockingly, one child in every 5 globally either lived in or fled from a conflict zone in 2023. Meanwhile, the climate crisis is worsening. Last year was the hottest in human history, with grave implications for health. Drought in the Horn of Africa has resulted in catastrophic hunger. Changing climate patterns and extreme events are driving deadly disease outbreaks in all corners of the world. The resurgence of cholera is especially concerning, with more than 40 outbreaks last year, an alarming record. In 2023, humanitarian funding also hit its lowest point in over a decade, right when it was needed most. Health cluster patterns received on average only 12% of the funding they appealed for. This is heartbreaking, and it's avoidable. It's why in 2024, we must step up. There are only two ways to reduce the human suffering caused by health crisis: increase the funding or reduce the needs. Neither is happening at the moment. The cost of inaction is one of the world cannot afford. When humanitarians cannot respond, lives are put at risk and the needs of communities increase. A lack of access to health services feeds cycles of poverty, drives displacement, and threatens progress on all aspects of human and economic development. Our commitment to governments, countries, and communities has always been to do everything in our power to protect the lives and health of people. This means being present on the ground, always ready to identify needs and public health risks, using the science to conceive and rapidly deploy and scale up a response. As 2024 starts, WHO is already responding to 41 health crises, including 15 of the highest level grade 3 emergencies. Together with our health cluster partners, we aim to reach some 87 million people with life-saving humanitarian assistance this year. To do this, we need support totaling $1.5 billion, and we need this funding to arrive as early as possible and with as much flexibility as possible. That's critical to allow us and our partners to deliver on our commitments. A reactive approach is not enough. We need to look beyond the humanitarian responses and invest more and better in strengthening capacities for preparedness and the resilience of health systems. My sincere hope and ask for 2024 is that we do not disappoint the people we serve in the most fragile places. I thank all humanitarian donors for their continuing commitment, and I urge everyone to step up to address the humanitarian needs we face and reduce the funding gaps that stand in our way. And I thank you.
Thank you very much, Dr. Tedros. May we now invite His Excellency, Dr. Abdullah Al-Rabia, Advisor of the Royal Court and Supervisor General of KS Relief, to kindly take the floor.
Thank you, Fabia. Excellencies and distinguished guests. Firstly, I would like to thank Dr. Tedros for inviting me to participate in this event to highlight the pressing challenges we face today amidst an ever-increasing number of global humanitarian crises. The levels of threat to the lives and dignity of civilians, particularly children, women, and the elderly, are at all-time high. Conflicts and disasters are forcing millions to flee their homes and thereby their countries. And every day, more and more people are unable to meet their basic needs. As always, the World Health Organization is at the forefront of the ongoing struggle to meet the healthcare needs of everyone living under difficult circumstances. KS Relief strategic partnership with WHO helps to provide comprehensive relief to those in need during health crises of any kind. It is also vital to enhance community resilience to deal with future crises, particularly in areas of nutritional support and reducing the spread of communicable diseases. Since its inception, KS Relief has provided humanitarian aid and relief to more than 95 countries, and we have worked together with 175 valuable partners to deliver more 2,700 projects with a cost exceeding $6.6 billion. Not only have these partnerships helped to improve vital aid projects, but also brought us together with other donors and partners to advocate for accessible health infrastructure, vaccine distribution, and localization to enhance community resilience. The world is facing unprecedented challenges which require us to work together by emphasizing the importance of evidence-based strategies to enhance impacts and prevention measures. Due to the many emergency situations, KS Relief is working with WHO to implement 5 projects in 3 regions and also expecting to sign several more shortly. Let us focus on urgent action and engage more donors to save more lives. May our gathering today ensure that sustainable impacts can be made in alleviating the suffering and ensuring healthier and brighter future to all. Thank you.
Thank you very much, Dr. El Rabia. May we now invite Her Excellency, Ms. Susanna Baumann, State Secretary at the German Foreign Office, to kindly take the floor.
Thank you very much. Dear Dr. Tedros, Excellencies, colleagues, and friends, thank you very much for convening this important meeting today. The outlook towards 2024, unfortunately, is very bleak. Almost 300 million people will need humanitarian assistance this year, and about half of them health assistance. We must increase our preparedness for health emergencies. We have to facilitate equitable access to life-saving medical countermeasures in health crises, and we must strengthen the prevention of disease outbreaks with a special focus on humanitarian contexts. These issues are our common responsibility and, of course, central to the negotiations for a pandemic agreement. But we cannot wait. The number of emergencies worldwide is increasing. Every person in need is already one too many. Our thoughts today are particularly with the people in Israel and Gaza, Ukraine and Sudan. People there are experiencing unbearable suffering and loss of their loved ones. Emergencies are exacerbated by wars, armed conflict, and the consequences of climate change. In order to sustainably overcome them, we need to address their often man-made root causes. But once again, this will take time. Now it is our responsibility as the global community to help the most vulnerable and support WHO's excellent work in humanitarian emergencies. On behalf of the German government, I wholeheartedly express my appreciation to WHO for its excellent and relentless work. We are particularly grateful to all colleagues in the field and all health and frontline workers delivering assistance in often very difficult and dangerous circumstances. Germany has contributed to the global WHO emergency appeals since their outset. Last year, our funding amounted to 20 million euros. In addition, Germany committed to a multi-annual support of the contingency fund for emergency. Last year, we were the largest bilateral donor with 21.5 million euros. For 2024, already at the beginning of the year, we have secured another 10 million euros for the CFE. Germany also supports specific regional activities by WHO. In 2023, these amounted to another 20 million euros, for example, in Ukraine or on the African continent. Recently, Germany delivered essential medical goods and equipment to Gaza, Egypt, and Jordan to cover the most urgent needs. Be it our continued support to WHO's work in humanitarian emergencies, it in the negotiations for a pandemic agreement or bilaterally. You can count on Germany to play its part in the global health, and we call on all of you to join us in this important endeavor. Because only together we can achieve a healthier, a safer, and a fairer world. Thank you very much.
Thank you very much. May we now invite Mr. Martin Griffiths, the Under-Secretary General for Humanitarian Affairs and Emergency Relief Coordinator. Thank you. You have the floor.
Thanks very much indeed. I would start with a couple of personal remarks before I go to my prepared remarks. The first is to apologize for the fact that I have to rush to another meeting. I would have much preferred to be physically present with you today for this extraordinarily important event. And the second is this. I thought I was the world traveler who went to crises. Everywhere I go, I find Dr. Tedros is there before me. And where Dr. Tedros goes follows Dr. Mike Ryan. And I'm thinking of the Syrian earthquake. I'm thinking of the Gaza conflict. Tedros, you are everywhere. And WHO is everywhere. And Mike, of course, you're making sure of it. And the other personal remark I want to make is recently I was talking to colleagues about the work that the humanitarian agents are doing in Gaza. And I was told that WHO is one of, if not the most effective humanitarian operation in Gaza. So all credit to WHO under the leadership of Dr. Tedros. And I'm very, very pleased to be with you today. And now back to where I was going to begin, if I may. In December, I launched OCHA's Global Humanitarian Overview for 2024, which set out our plans to meet the humanitarian needs of 181 million of the most in-need people in 72 countries this year, an astonishing range. Across many of these crises, conflict, climate change, we've heard these things already, disease and economic instability are interacting, are synergizing to create deep and increasingly complex health emergencies. And Dr. Tedros, I agree with you completely when you characterize emergencies as health emergencies at their core. In Sudan, for instance, the conflict that erupted last year stretched the health system immediately far beyond its capacity and left it unable to provide the everyday care that people depend on, let alone adequate medical attention to the civilians injured in the fighting. Weak disease surveillance, low vaccine coverage for preventable diseases have contributed to recurrent measles outbreaks. So too in Haiti, Somalia, Yemen, and many other countries are infectious diseases being driven by and exacerbating the broader humanitarian crises. They are indeed, as Dr. Tedros has said, at the core of the problem. At least 29 countries have reported outbreaks of cholera, including in countries that have not reported the disease for many years. 1 billion people are at risk of cholera. As the climate crisis continues to deepen, so do the associated health risks of malnutrition, malaria, diarrhea, and heat stress. Direct costs to healthcare from climate change are expected to range between $2 to $4 billion per year by 2030. And global health is under threat like never before. In 2023, 1,300 attacks on healthcare across 19 countries led to more than 700 deaths and 1,100 injuries to health workers and patients, deeply impacting the ability to address heightened health needs in crises. In the occupied Palestinian territories alone, more than 624 attacks on healthcare have resulted in the deaths of 619 health workers and patients and the injury of 826 others. This is as of the 11th of January. Since the 7th of October, and you'll shortly hear from Denise Brown about the impact of the war on Ukraine on health. And what we're seeing here, as a colleague in WHO once said to me, is a pandemic of attacks on health institutions. There has been a year where health institutions have been targeted as a priority in many, many countries, in Sudan, certainly, in Gaza, certainly, in Ukraine, as Denise will discuss, and elsewhere. That Red Cross sign, which was there to protect people, has become a sign for an attack. And just as if the issue of health is at the heart of so many crises, therefore, so, as I said right at the outset, is the role and presence and aid of the World Health Organization. You were on the ground in more than 150 countries, working with 900 international, regional, and local health cluster partners to deliver vital health assistance. You offer unique expertise and capacity to save lives. You develop norms. You make assessments. You're there in solidarity with the people who have the need for medical attention. And you have more than shown your ability to do so. In 2023, WHO led the health cluster in meeting the health needs of 102 million people across 29 countries. They supported more than 44 million primary healthcare consultations. WHO deployed more than 8,000 mobile clinics and helped distribute 30 million oral cholera vaccine doses. And WHO's role in the coming year will be no less important. In fact, as Tedros said, we fear the worst has yet to come. That's why, for these simple reasons, these factual reasons, nothing romantic or sentimental about this, the need for the World Health Organization as a fully funded, fully fledged, fully present partner in humanitarian operations is essential. And therefore, of course, I fully endorse the emergency appeal for 2024 and call for support for Dr. Tedros's call for funding the WHO needs to do such vital work. And frankly, the sum asked is a very small price to pay to protect the health of the most vulnerable and to prevent the deepening of a global health crisis. I consider it a rare privilege of my job to be in a position to call WHO and its staff a colleague and a partner and people who are always present. And as I said at the beginning, usually before me, thank you very much.
Thank you very much, Mr. Griffiths. May we now invite Ms. Denise Brown, the UN Resident Coordinator and Humanitarian Coordinator in Ukraine. Thank you very much. You have the floor.
Thank you very much. Usually I'm sitting in Kyiv, but this week I happen to be sitting in the Palais, but I'm not with you because this morning with Martin and Filippo Grande and the First Deputy Prime Minister, we launched the Humanitarian Response Plan, which for 2024 is over $3 billion, about 10 million people. So we're still at a very high level of emergency in Ukraine. But right now, I'm just coming from a side event on protection that we organized with WHO, with UNHCR, where we talked about the mental health trauma. The trauma we can't see, so it's not so easy to fix. We can't rebuild it, we can't repair it. And we came to the depressing conclusion that it will take a generation to overcome the trauma due to the war that Ukrainians are suffering every day. First point I wanted to share with you is that, as you know, healthcare is a service, but it's not just a service. From what I've seen in Ukraine, particularly in the communities along the front line, the availability of healthcare holds a community together. Every community needs a doctor, needs a nurse, needs a healthcare professional, a place to go when you're sick, when you have a baby to deliver, surgery, vaccinations. So unfortunately, the flip side of that is that the loss of healthcare disrupts the well-being of a community. people have to leave. And that's what we see oftentimes in these communities directly impacted by the war in Ukraine. And so I would argue that the loss of healthcare also means the beginnings of the loss of a sense of community. Following the full-scale invasion by the Russian Federation in February 2022, according to WHO, more than 1,400 attacks on health infrastructure in Ukraine. Since the 29th of December 2023, which we don't include today, is 17 days, there have been 14 attacks on healthcare structures. 14. So that's basically almost one a day. An attack every day on the healthcare system, which erodes the support that Ukrainians desperately need, both because of the physical consequences of the war, but also because, again, that sense of community, which is so important at this particular time in Ukraine. I was recently in a place called Seversk, which is frontline community about 6 kilometers from Bakhmut. I'm sure many of you know Bakhmut. The clinic there was destroyed last year, but I met the doctor who was still there, an elderly woman who basically set up her clinic in her home so that the living room is now the place where she conducts her consultations, and the kitchen is where she stores the supplies, materials, equipment that are provided by MSF, ICRC, WHO, and the Ministry of Health. So healthcare in Ukraine, in many of those frontline communities, is about the determination and dedication of the healthcare professionals who continue to require the support that institutions like WHO is providing. In Hoza, in Kharkiv, and Hoza, I spoke about it this morning in the launch, is a small community in Kharkiv that on the 5th of October of 2023 was hit by a missile right in the center of town. Within seconds, it killed 59 people, 20% of that community, for no apparent reason. There is no military installation there. 59 dead and countless injured. We were there the very next day, myself, WHO, OCHA, UNHCR, the local authorities, and we provided them with not just that immediate psychosocial support, but the healthcare professionals desperately needed additional equipment and supplies, which we provided. So this is about immediate support. This is about providing services. This is about reinforcing systems and capacity. This morning, in the launching of our humanitarian response plan, which again is going to be huge for this year, I am pleased to say, and I heard what Martin was saying, WHO's appeal is very much aligned with that plan. I'm very pleased with WHO in Ukraine for their active participation, for their deliveries with us to the front line, for their support to the Ministry of Health, for their leadership on the psychosocial trauma. I am, however, very concerned at the potential for our humanitarian funding in 2024 to be decreased. We've been able to do a lot in Ukraine because of our capacity, our experience, our willingness to take risks, but I can't do much unless we have the funding. So I wanted to thank you again, Dr. Tedros, for the opportunity to speak today with that message. The war is not over. The suffering continues, and the support of member states continues to be absolutely fundamental to the work that we do, including in the healthcare. Thank you very much.
Thank you very much indeed. We shall now hear from the Right Honourable Gordon Brown, former Prime Minister of the United Kingdom and WHO Ambassador for Global Health Financing. Mr. Brown, you have the floor.
The World Health Organization have identified a total of 165,700,000 men, women and children from Ukraine to Afghanistan, Yemen, Syria, South Sudan, Ethiopia, DRC, the Horn of Africa and Haiti, who as a result of war, epidemics, famine, drought or floods need emergency medical assistance and support immediately if we're not to abandon them to disaster, disease and death. I think of the maimed and injured of Gaza and Israel, the victims of war in Ukraine, those dying from starvation in Afghanistan, those who have lost the food and nutritional help they were receiving in so many other parts of Africa, all of whom now need medical help and support urgently. So in thanking the staff of the World Health Organization led by Dr. Tedros for your never-ending commitment day in and day out to life-saving work, I want to lend whatever voice I can to support the WHO 2024 Health Emergency Appeal for $1.5 billion. Let me be blunt. Whether or not we can raise this money will determine who will live and who will die over the months of this year. For we have to remember that in the cascade of crises we face, climate, conflicts, and poverty, every humanitarian crisis is also a health crisis. And we will continue to face crises from mpox to measles, from dengue to diphtheria, from Ebola to cholera, that will continue causing despair, desolation, and death as long as we continue to underfund basic health care. But if successful, the Health Emergency Appeal 2024 will enable the Global Health Cluster, led by Dr. Tedros, to reach some 87 million men, women, and children. That's a population we can help that is greater than that of Germany or France or the United Kingdom, and prevent them from suffering unnecessarily or dying from avoidable illnesses or disease. If we were to save one life now at risk, this appeal would be worthwhile. But to be in a position to save 87 million lives makes the success of this appeal a moral imperative. And funding this appeal is a moral imperative also for this very region. We say that we value every human life equally, but if we don't offer life-saving treatments equally, care for everyone equally, vaccinate everyone equally, that failure to fund the basic human needs of the most vulnerable and most at risk in the poorest corners of the world will forever be a wound that in future years we cannot heal, a stain on our soul that as long as we live will not fade, a blight on humanity's common conscience that will not easily mend. And so I appeal to funders to finance the health emergency assistance we need. And I would urge you to give now so we can plan ahead, for we must not continue to leave the World Health Organization and its partners having to scramble for months into the year for funds for the life-saving work, when, as Martin Luther King said, there is the fierce urgency of now, acting now. Last year saw a significant drop in funding for humanitarian relief. In 2024, emergency health delivery needs will grow, so it is imperative that we all step up to support and fund healthcare. In a world where the year has started with violence and death and suffering in every continent, your support for this appeal will also send a message of hope to counter current despair. Hope dies, you know, when doctors have to give up on treating patients, when no drugs are any longer available, when nurses don't have the basic equipment they need to provide even the most basic of care. But as we have seen in the video at the beginning, hope will come alive if through this appeal we enable the World Health Organization to continue to work to help a mother deliver a baby safely in a war zone, to help vaccinate a child, to provide mental health services to a father scarred by conflict, and to give a grandmother in a shelter her life-saving diabetes treatment. So today, I call on governments and all funders to give to this emergency appeal and to support the WHO and to give it the means to deliver health to the most vulnerable. Let us be the ambassadors and agents of hope.
Thank you very much. We're now going to hear from some of our colleagues on the ground, but before doing so, I have the pleasure in inviting Dr. Mike Ryan, the Executive Director of WHO's Health Emergencies Program. Thank you. Dr. Ryan, you have the floor.
Thank you. I was reflecting on what I might say here today, but I think what they said, what Martin said, what Denise said, what Gordon said, what Abdullah said, what Suzanne said, it's a very humbling moment to have our work reflected back to us by our partners and mentors, our investors and others. So I thank them deeply for their kind words towards the work of the organisation. And first of all, we pay tribute to many in this session. I think the people we have to pay tribute to most and recognise is the communities that we all serve, that we serve, that governments serve, that donors serve, that partners serve, that advocates serve, because it's their courage, it's their resilience, it's their patience, because they must be very patient, to wait and wait and wait for assistance, to wait and wait for aid, to stand in line, to walk the miles they walk, to bring their kids to healthcare. We need to bring that healthcare closer to them. We need to make it faster, more effective, more equitable, fairer. For that, we must protect their lives and their health. We must protect their services. We must protect their health workers, because we must protect their future. Looking back on 2023, for all of us, it's been a very trying year. The combination of natural disasters, climate, many of them climate-induced, the increases in conflict, the increasing frequency of epidemics, has been illustrated by many speakers, especially things like cholera, the brutality and intensity of conflict, the targeting of healthcare. All of this has become intertwined and self-amplifying. It's meant that doctors and nurses have been unable to deliver the assistance. It's meant that women have not been able to give birth safely. It's meant that children haven't received their immunisations. It's meant that older persons haven't received their chronic care medications. Because people, even if they have a health service available, they're too busy looking for food or avoiding bombs. This increase in disasters, and it's been mentioned by many, but the one that most concerns me at the moment is the rapid increase in hunger driven by climate, driven by conflict. This is in itself causing a major secondary health disaster. In famine and in nutrition crisis, the vast majority of people will actually die from infectious diseases and other causes. Famine is what weakens the human immune system. It weakens the human capacity to resist disease and very often creates the conditions for a secondary health crisis. Martin and others mentioned the devastating impact of attacks on healthcare. We are witnessing an era in which attacking healthcare has become a tactic of war, not euphemistically referred to before as collateral damage or accidental damage, but actually fundamentally a weapon that is used to increase the terror and to deny people the health service that they need. And as Denise said, when health services disappear in the community, when education services disappear in the community, that's the last straw. That's what drives migration. That's what drives displacement. People do not want to leave their homes. They don't want to move across a country, between countries or across continents. They only do that when they lose the core services that preserve their lives, preserve their livelihoods, and give their children a chance for the future. This is really, really unacceptable. We did all we could in the last year with our partners to respond, and I must highlight here our partners, because WHO cannot do anything without our partners. The 900 partners in the health cluster, our partners in the emergency medical team movement. Right now, as we speak, there are 10 emergency medical teams on the ground in Gaza, with 16 more on standby. Incredibly brave people deploying into the field from multiple countries and institutions. Our partners in the Global Outbreak Alert and Response Network and the Global Health Emergency Corps. So many others out there doing their thing, supporting communities and working with WHO. There is no way that we can deliver all of this without their partnership. But those partners need supplies, they need resources on the ground. We have increased and stepped up our ability to deliver life-saving supplies from our WHO logistics hub in Dubai and sub-hubs in Africa and in the Americas. We've delivered over $30 million worth of life-saving supplies to countries like Afghanistan, Chad, Libya, Morocco, Sudan and Yemen. And as I said, none of this could be done without the close cooperation of our partners. I see this all when I travel to the field. I wish I could travel to the field more, but the job I have requires that I be the advocate for this work. I really want to recognise not only the work of our partners, but the work of the thousands of WHO staff around the world, the ones who aren't sitting here today, the ones that are deployed in so many different countries. Ultimately, it is them, our staff, and our partners that are at the heart of our efforts. The community organisations, the health and social workers, the local NGOs, and again, that need for us to build better community resilience. It is communities who respond They're the first responders, they're the last responders, they're the best responders. Our job is to empower them and bring them the tools and the services that they need at times of crisis. It's difficult for me to express how important it is that we get the resources up front that would allow us to plan and do these interventions over and over again. We've responded to over 65 major graded health emergencies last year. That's more than one a week. And those health emergencies don't last a day or a week or a month. Many of them last for years. As was said before, behind every conflict, every climate crisis, all food crises, all protection crisis, there is a health crisis. And again, I will finally say that we can't do this without our UN partners. Martin spoke to, and I was very touched by Martin's words, but without the Interagency Standing Committee, without the work of OCHA, coordinating all of the humanitarian partners, we would find it very, very difficult to deliver what we do. Everyone's talked about the outlook being bleak, and it is. It's bleak from a human suffering point of view. It's pretty bleak from a funding point of view. We hope that can change. But what isn't bleak is human endeavour and human courage, and the desire of communities to rise up and transcend the suffering that they're in. Our desire as partners to deliver for them. What we need is a reprioritisation within our donor partners and others. We need to find the courage, we need to find the funds, we need to have the ambition to recognise that all of this, as Dr. Tedros said, is avoidable. Much of this is avoidable. And with your help and your resources, with your investment, I believe we can do this. We can't do it without your help. We will continue to do it no matter what. It's interesting in the various traditions of the world that the issue of service and the issue of serving those who have less is constant. Confucius said, "He who wishes to serve the good of others has already served his own good." Buddha has said, "If you knew what I know about giving, about the power of giving, you would not let a single meal pass without sharing." And those who have the God of science at their heart, Einstein said, "Only a life lived for others is a life worthwhile." So I think at this point we would just pass on to our other colleagues here, but just a thank you, not just a request. Thank you to those who've given to us so much over the last number of years. Our partners, our donors, our investors, our mentors, and our critics who have stood fast and given us the kind of constructive criticism that's allowed us to build a stronger programme again and again, year on year. Thank you.
Thank you very much, Dr. Ryan. And we're now going to move to the WHO representative in Haiti, Dr. Oscar Barreneche. Dr. Barreneche, you have the floor. Thank you.
Good morning from Port-au-Prince, and thank you for the opportunity. The security situation in Haiti has unfortunately continued to deteriorate to levels never seen before. In 2023, compared with the previous year, there was an increase of over 130% in serious crimes such as kidnappings, killings, including by lynchings, and gender-based violence, particularly rape. The armed gangs now control 80% of the capital. Gang activity has forced hundreds of thousands to flee their homes and seek refuge, mostly with relatives. However, approximately 200,000 people are now living in precarious conditions in improvised sites, in schools and other public areas, making it increasingly difficult to provide services. The impact in the economy has been disastrous, and now, as the violence spreads in the country, almost half of Haitians are facing the consequences of food insecurity, which explains the whopping 30% increase in the case of acute severe child malnutrition observed recently. PAHO WHO is present in 25 of the 74 sites in Port-au-Prince, supporting the local health authorities providing basic health services to approximately 25,000 people, including nurse consultations, referral, vaccination, psychosocial support, and health education and promotion related with health issues such as cholera and gender-based violence. We are also supporting health surveillance activities and the decontamination of those sites. Recent months have seen the constant violence between gang factions in their struggle to control parts of the territory, causing road blockades, which make it incredibly difficult to deliver life-saving supplies, including fuel for hospital operation. PAHO WHO, of course, is also supporting the response to the ongoing cholera outbreak, which started in October 2022. More than 77,000 cases are now being reported from all departments and all communes of the country. Haiti is observing a shocking rise in gender-based violence. Over 6,000 cases were reported only during the first half of last year, affecting mostly the Artibonite department and the capital area. The latest humanitarian response reports that only 16% of the target survivors were reached with services. The mental health impact suffered by the population because of the situation is very acute. There are simply not enough human resources that can cater for the urgent need. To complicate the situation, many of the trained healthcare workers are opting for the possibility to migrate abroad in the hope of a better life, forcing the reduction and sometimes the closure of services. Health facilities are experiencing difficulties in ensuring the sufficient provision of medical supplies, safe blood products, and even the sufficient fuel for operating. The consequences are very worrying. During the past year alone, there has been a reduction of approximately 40% in antenatal care consultations and over 20% reduction in institutional deliveries. The health sector is also a direct target of violence. Healthcare workers have sometimes also been victims of kidnappings and killings. The glimmer of hope comes with the adoption of the UN Security Council Resolution 2699, which authorized a specialized multinational mission to support the Haitian National Police in restoring stability in the country. The mission is expected to start during the first quarter of 2024. And besides supporting the work in restoring law and order, it should also focus on protecting the ensuring safe access to health facilities. PAHO WHO is supporting the Ministry of Health for the preparations of the mission deployment, including its possible consequences on the health sector. We are also facilitating the coordination with partners within the health cluster for the provision of the overall humanitarian response. The most acute needs in Haiti are related to sustaining the response to the cholera outbreak, the needs on equipment and medical supplies, including for the provision of safe blood products, support the human resources in their training, including for the mental health and the response to gender-based violence, strengthening the nutrition stabilization units, and the support that it continues to be needed for sustaining health surveillance. Let me end by ensuring our unwavering commitment to continue to support addressing the health needs of the population of Haiti during this, one of the most difficult times in its history. Thank you.
Thank you very much. We'll now move from Port-au-Prince to Nairobi, where we're going to hear from Miss Lisbeth Elbrecht, who is the Incident Manager for the Horn of Africa response. Thank you. You have the floor.
Thank you. Good afternoon, Dr. Tedros, Your Excellencies, distinguished ladies and gentlemen. It is my pleasure to join you here today from Nairobi, Kenya, on behalf of the Greater Horn of Africa teams. The Greater Horn of Africa, which is one of the most vulnerable regions when it comes to climate change, and that appears through erratic rainfalls, rising temperatures, which then translates into droughts and floods, which in recent years have become much stronger and more likely. That historic 4-year drought, which hit East Africa, caused, as you all know, massive displacement and suffering. And now, over the past few months, El Nino has exacerbated these needs, bringing exceptional floods in that same Horn of Africa, while El Nino is bringing more drought to other parts of the region, mostly the west, notably northern Ethiopia and large parts of Sudan. And the increase in these deadly climate-related disasters, together with conflict, has driven extremely high levels of hunger. Currently, more than 50 million people are food insecure, which actually represents more than 30% increase compared to mid-2022, when WHO first graded this emergency. And these different drivers have actually had a severe impact on people's health. First and foremost, we're seeing the highest numbers in years, actually, of malnourished children, including 2.7 million with severe acute malnutrition, which not only increases their risk of starvation, but also weakens these kids' immunity, which makes them much more susceptible to disease. And to quote a colleague, often between malnutrition and death, there is a disease. We are also seeing a surge in disease outbreaks whose incidence can be directly linked to extreme climate events, to conflict and the consequent displacement. And outbreaks of cholera, measles, malaria have all worsened in these regions. 4 of the 7 countries are actually currently dealing with cholera outbreaks. Disease outbreaks, we have to mention, are also flourishing when people leave their homes in large numbers. And this region hosts as many as 20 million displaced people. And interestingly, today that includes 4.4 million people who have left their homes because of natural disasters, because of these droughts and floods. Now, the role and the added value of health in preventing and responding to these food crises, these malnutrition and famine emergencies is underestimated. Yes, yet it is vital. It is a crucial element in reversing that causal effect between poor nutrition, disease, and death. And that is why WHO has widely scaled up its response. It is focused on ensuring that vulnerable populations, especially children, have access to essential health services. It is focused on protecting populations from disease, mainly through immunization campaigns, focused on rapidly detecting and responding to these disease outbreaks, and providing treatment for those children with severe acute malnutrition and disease. I want to wrap up with a clear message of hope and reassurance, despite of what looks like a gloomy or bleak outlook, as Mike said. WHO can provide the humanitarian health assistance which is required. We can do this. We know how to do this. We have the expertise, we have the amazing workforce, and we have that privilege of partnering with incredibly resilient communities, and with an extensive network of local and international partners. And we've seen actually that with well-funded concerted action, it was even possible to avert famine in Somalia. It was possible to nurse sick people, including those severely malnourished babies, back into health all over the region. And that is why, on behalf of my colleagues and our partners here, I would like to sincerely thank you all for your vital support. I would like to acknowledge the donors. I would also like to give thanks to the media for giving visibility to these crises and the plight of the affected populations. Together, we do save lives. Thank you.
Thank you very much. We're now going to move from Nairobi to Damascus by way of Geneva, as we're joined by the WHO representative to Syria, Dr. Iman Shankiti, who will be our final country speaker for today. Thank you very much.
Thank you, Fabia. Good afternoon, and thank you for the opportunity to highlight the situation in Syria, including the challenges and the priorities for health. In March 2024, the Syria crisis will enter its 13 years, with humanitarian needs at its highest level since the start of the conflict. People in Syria continue to suffer. In 2024, it is estimated that 16.7 million people will need humanitarian assistance, out of which 15 million will need life-saving health assistance as a result of protracted conflicts, a series of earthquakes in 2023, and a worsening economy, and new threats to security situation in Syria. The health system is in peril, and the recent Whole of Syria study has identified numerous high-risk threats to health. Communicable and non-communicable diseases continue to threaten the population. Chronic diseases account to around 75% of mortality. Outbreaks of diseases, once episodic, are now common in Syria due to determinants such as water scarcity and contamination, limited access to essential health services, healthcare workers' migration, insufficient and overcrowded shelter settings. Adding to this is the threats of escalation of hostilities in the country and within the region. Despite being on the brink, the health system still serves as a last resort safety net when patients increasingly fall through the cracks due to the cut in food, nutrition, protection assistance, while the level of depression and stress-related disorders are elevated to 200 and 600% compared to previous years. Failure to invest in life-saving, life-sustaining essential health services lays the groundwork for further deterioration in humanitarian conditions in Syria. And it is the most vulnerable, namely children, women, and elderly people with disabilities and the displaced, including those residing in camps and camp-like settings, who will be left behind to suffer increased mortality and morbidity as a result. Women, like the 70-year-old Yasin, who resides in an IDP camp in northeast Syria and contracted cholera during the recent outbreak, she says, "The world seemed to spin, and my strength have left me. I was scared." WHO supported her referral to a nearby hospital, where she received crucial, critical medical attention and was given a second chance at life. A principled humanitarian response, including unrestricted access for humanitarian assistance, will be critical to delivering this life-saving assistance, as will be the importance of protecting health facilities and health workers who should not be a target. To deliver on our work in 2024, we need around $79.8 million to reach 15 million people in need of humanitarian services. In 2023, we saw a decline in funding, with several donors reducing or ending their assistance. The consequences of these cuts is painful. A program that WHO has been running since 2017, which has supported 10,000 critically ill patients on an annual basis with emergency referral, targeting host communities and people living in camps in northeast Syria, will be suspended by the end of Q1 2024 due to funding cuts, and patients like Yasin will lose this lifeline in an area where just 1 in 16 hospitals is functional. Yet, with sufficient resources, WHO can sustain its commitment to ensuring medical support for everyone, regardless of their circumstances. We cannot leave Syrian people facing the devastating impact of the crisis alone. With our continuous financial support, WHO will do everything to provide humanitarian health assistance in Syria and will continue to pursue all modalities approach to health assistance within the country, cross-border, and cross-line. Thank you.
Thank you very much. May we now invite Dr. Mike Ryan to give some closing remarks. Thank you.
Yeah, I think we're a little behind time, so I'll be very, very brief. Dr. Tedros had to step out to deal with an urgent matter. Please not trying to get a jump on Martin again. Thank you again to Tedros, to Abdullah, Suzanne, Martin, Denise, Gordon, Oscar, Elizabeth, and lastly to Iman sitting here beside me. I don't think I need to go back over all that has been said. 166 million people need your life-saving health assistance, our life-saving health assistance. The climate crisis, the drought, the catastrophic hunger, the increasing violence and the deadly outbreaks, all intertwined and self-amplifying. And I think the poster child of that right now is the resurgence of cholera, and as Gordon said, 1 billion people at risk at the moment. So, but Tedros also said that, you know, during this time of greatest need, we hit the point of lowest funding. So either, to deal with this, we either have to increase the funding or decrease the need. And right now, the need is not decreasing. So we have to find a way to step up. And that's what Tedros said, we must step up, not just we need to become more efficient in the humanitarian community. We need to pick our targets well. We need to decide what is the most important work to do. We've worked hard at that in WHO to target this appeal to only those essential needs. And that's been a very, very difficult task. We would love to have asked for more money because you know what? More money is required. We've tried to keep focused on what's absolutely needed. And we hope that you, our donor partners, can look to that, because together we can reduce the human suffering caused by humanitarian crisis. There are costs. The cost of doing this is high. The cost is high in terms of money. The cost is high in terms of the risks that our staff take every day on the ground. But the cost of inaction is higher, and there is a cost of inaction. A lack of access to health services in these situations feeds poverty, drives displacement, drives conflict, threatens progress on all aspects of human and economic development. Many, many countries are drifting off. I feel like a tectonic plate is opening in the world, and there are so many countries that are just separating from the rest of the world. Health and development are entirely disrupted. There is no connection. Countries are lurching from crisis to crisis. We have to break this cycle. We will do our part. We know the solutions aren't just humanitarian. There are political solutions needed. There are economic solutions needed. But we, the humanitarians, stand in the front line. We stand there to preserve life and save life until longer-term economic and political solutions can be found. So we call on our partners to support us, support our partners, so that we can best serve those who we all serve. And in the end, the people we serve are the communities suffering these crises as we speak today. Thank you.
Behind every conflict, climate, food, and humanitarian crisis, there is a health crisis. In 2023, emergencies disrupted the lives of millions of people around the world with an enormous impact on health. Thousands of health professionals responded, many on the front lines. And WHO was there to support them. When they ran mobile clinics to treat trauma wounds, when they went door to door to deliver life-saving vaccines, when they coordinated with partners, and when they delivered medical supplies to reach hospitals in need. But why do they do this?
Because the children need us.
For them and for their families.
Alleviate their suffering.
To have a future.
Have access to quality health services they need.
For the most vulnerable.
Because it's the right thing to do.
Because health is everything.
Parce que l'urgence humanitaire met en priorité.
Because I want to help.
Make my life meaningful.
We are people with solutions. We are people who are doing what it takes. We are committed, intrepid, and determined. We are the World Health Organization. In 2024, WHO will continue to work to help a mother deliver her baby safely in a war zone, to help vaccinate a child, provide mental health services to a father scarred by conflict, and to give a grandmother in a shelter her life-saving diabetes treatment. But we can't do this alone. In 2024, WHO needs $1.5 billion to respond to the health needs of the most vulnerable children, women, and men. For this, we need your support to do everything we can and more.